Hello, I'm Jeremy Fernandez. Tonight on The Virus, Melbourne's suburban testing blitz. Can those clusters be contained? Plus, concern for Latin America, with global cases growing by 1 million a week. But first, Victoria is escalating its response to the continuing rise in new COVID-19 cases there. 10 consecutive days of double-digit increases has put the government on edge. It's fast-tracked a public blitz with the aim of doing 100,000 tests across 10 problem suburbs. Those are Broadmeadows, Keilor Downs, Maidstone, Alban Vale, Sunshine West, Brunswick East, Fawkner, Reservoir, Pakenham and Hallam. 1,000 community workers will go door to door. Defence Force personnel have also been called in to help. Infections in those areas have been linked to a supermarket warehouse, a McDonald's restaurant, a youth mental health facility and 2 childcare centres.
The numbers will grow, but that's exactly the strategy. Find these cases. The real trick in this virus is what you don't know, until, of course, it's too late.
We really need people to go back to that activity that they were undertaking in April and May, with physical distancing, with hand hygiene, with staying at home if you are unwell or you have symptoms, getting tested if you have symptoms.
The surge in Victorian cases has pushed the national daily case rate to its highest level in 9 weeks. The majority of them are still from travellers arriving from overseas and going into hotel quarantine. The Prime Minister says Australia's coronavirus strategy is on track despite the Victorian clusters.
So it is a reminder that outbreaks will happen, but at National Cabinet today they remain firm on sticking with the 3-step plan and continuing to make their announcements of easing restrictions that will continue into next month.
So that stance is backed up by the figures which show 92% of Australians who contracted the virus have now recovered. That leaves just 195 active cases across the country. The majority of those are in Victoria. Interestingly, New South Wales reclassified its active cases this week. It's no longer including cases acquired overseas, leaving the state with just 6 local residents currently known to be infected. So what should we make of this rise in the number of cases? I spoke with the Melbourne epidemiologist, Associate Professor Hudson Valley, and our national medical reporter Sophie Scott earlier. Dr. Valley, you're joining us from Melbourne in one of these hotspots, in fact, where people are being diagnosed in greater numbers. I wonder if you could tell us what it's like being there for those of us watching anxiously from elsewhere in the country.
Yeah, look, it's really interesting because, up until a few days ago, it was really noticeable that people were really enjoying their freedoms and you just got a sense of things heading back to normal. But then, we've had a little bit of a shock and you can really see it out in the community. It feels a lot quieter now. And so clearly people are taking this upswing in cases quite seriously and are a bit concerned.
Do you have a sense, Dr. Valley, about what the issue here is, why Melbourne is particularly seeing these clusters breaking out?
No, look, I think, we don't know, and there's got to be an element of luck involved. And I guess it really is a lesson that this is what could occur, and it was predicted. And there's no reason why what we're seeing in Victoria now won't happen in New South Wales in a few weeks' time. So it's just part and parcel of having cases in the community when you relax restrictions, because if you relax restrictions, you bring people into closer contact with each other or into more contact with each other, and you're always going to have these periodic upswings. And the most important thing is that our health departments have prepared for this and they're responding pretty rapidly and decisively to try and squash transmission. And that's why they're doing all the testing, and that's why they've got these teams visiting these high-risk suburbs. So we're probably going to have to get used to this for the next 6 to 12 months.
Sophie, for those watching from other states and territories, I know we've even got viewers from overseas as well. What's the cautionary tale here? What lesson do we take away about preventing these clusters breaking out, or is that out of our hands?
Well, look, I think it's a harder public health message to sell. When we were in lockdown, we all knew you can't go outside, you can only go outside to, exercise or do your shopping. Now it's much more complicated than that. But what hasn't changed is the social distancing, and that's to stay a certain distance away from people. So even if you're in the same household or the same environment, you're really not supposed to be getting too close to people. And so that's the thing that we need to keep in mind. And they've been tracking social distancing, and they found when the peak of the lockdown was happening that 80% of Australia was practicing social distancing, and that's now gone down to 25%. So most of the people are not keeping their distance, and that's a problem because no matter how good everything else is, if you're in close contact with people for a long time and there's virus circulating, it's going to spread. And so that's one thing we need to be constantly keeping in mind, that the social distancing is really, that's the key to stopping the spread of this virus, as well as things like good hand hygiene. And it's interesting to think about that. I don't know about you, but I haven't seen many of the public health messages on TV or coming up on my phone, and there seems to be a bit of a drop-off in the public health campaigns. And I think that's a mistake. I think we need to keep it in front of people's minds that even though the restrictions are being eased somewhat, those things, those basic things are still really, really important.
Dr. Valley, there are others who are anxious about this outbreak in Melbourne and wonder if this is the start of what they call the second wave, of the second peak. And I know you feel quite strongly about the terminology that we're using here and not trying to kind of overplay it somewhat. The term second wave has been bandied around quite a lot in the media. Is this a second wave?
Yeah, look, it's a really good question, and you're right, it is one of my sort of hobby horses, and the second wave is a very evocative term, and it is quite useful too because it does sort of convey that we're seeing a subsequent peak in infections. But the reason I like to clarify this issue is because there can be a bit of a conflating of what is happening now with what happened during the Spanish flu. And the second wave in the Spanish flu was when the influenza virus, which is very different to coronavirus, kind of disappeared and then came back, and it came back in quite a different form. And when it came back in this second wave, it was much more virulent, or it caused much more severe disease. And that's when all the damage was done. So I'd just like to make that distinction because in this situation, we're not really seeing that. We're not seeing a more virulent virus or a more severe disease. We're kind of seeing a continuation of transmission and what looks like happening in Victoria, a bit of an upswing. So it's just important to clarify that there's no signs that this virus is any different to how it was 2 months ago, but we are seeing we're potentially seeing an additional peak.
In relation to that AFL player who tested negative and then positive and then negative again, what happened there?
Yeah, look, I mean, that's a really good question. And of course, Victorians being very football passionate, they're all interested to try and understand this. And, the short answer is we're not sure. The longer answer is there are a few different possibilities. And obviously a lot of people are sort of jumping on the possibility that it could have been a false positive, so that this player is not actually infected. But I think that's a premature conclusion because it's very possible that this player has been infected and has been, if you like, incubating the virus, but that the levels of virus circulating in his body have not been particularly high. And so he's had that one positive test, then he's had a negative test. But there's no reason why, if you track this player for the full incubation period of COVID-19, that he may not start shedding virus and start testing positive again a bit later on. So I think the health department are treating this player as if he's a positive, which is as inconvenient as it is, of course, for the Essendon Football Club and for this player. I think it's a very sensible way to approach this. So yeah, just making the point that A lot of people have assumed it's a false positive, and I don't think we could jump to that conclusion just yet.
A number of viewers watching from regional Australia are also saying they're concerned about the mobility that you see during school holidays. What's your best advice about keeping all that under control, particularly as people head away from the cities?
Well, look, I think it's very individualised. Like the advice depends on whether you're from Victoria, whether you're from a hotspot, whether you're from New South Wales. Certainly, I think people need to be listening to what their health officers are telling them particularly. So the advice differs really where you live. Like, for example, Victorians have been told it's okay to travel in Victoria. You've seen, though, we've had images of people arriving from Victoria on planes in New South Wales, and some of the people in the places they've been arriving are saying, we're concerned seeing Victorians pile into New South Wales. But the other thing is it's difficult. You can't close borders completely, and those regional tourism operators, they want the people there. So it's not clear cut, because if you say to people you can't travel, you can't do this, then the tourism sector is going to suffer even more than they already have.
Dr. Valley, do you have any sense of how widespread antibodies would be in the population from just having exposure at some stage during the course of this pandemic?
Yeah, look, that's a big unknown. I mean, I guess what's interesting is that even, in the early days when people are talking about herd immunity and that being the solution to this situation, and by herd immunity, we were talking about getting herd immunity by everyone getting infected, or 60% of the population being infected. What we've seen is even those countries that have been most devastated by this pandemic, they're sitting at only 5 to 10% of the population being immune. So that's a fairly small number of people that have been exposed to the virus, but a massive amount of devastation and a large number of deaths. So, we're sitting on very, very low numbers of people that have been infected in Australia. And so we would have a very low number of people with antibodies. And then, of course, the next question that we don't know the answer to is how long those antibodies last. So how long does immunity last? And, of course, this is a brand new virus, and we've only had 6 months of experience with it. So we don't actually know the answer to that question.
Hudson Valley and Sophie Scott there. An expert committee says the Victorian outbreaks could have been less severe if the federal government had taken advice to engage more with migrant communities. Stephanie Dalzell explains.
About a month before the outbreaks, the Chief Medical Officer received a report from an expert committee set up to offer advice on the health response to the crisis. It received feedback from community leaders who said they'd been involved in the government's response to the pandemic on an ad hoc basis or not at all. The committee described that as a missed opportunity and recommended addressing it to reduce the risk of the virus spreading.
Often what we see is that government policy and programs for multicultural communities and other vulnerable community members is always a band-aid solution.
Migrant communities are among those considered high risk for COVID-19 because they're more likely to have other chronic conditions, less likely to access healthcare, and can miss out on important public health information. The government's translated its health advice into multiple languages and insists it's engaged adequately.
There have been 4,300 consultations with migrant leaders or communities in different ways, shapes or forms.
To connect with those who miss out, relevant and trusted grassroots campaigns are key. That's a long and complex process, much more difficult than simply dubbing or captioning a ready-made campaign. But it's a necessary part of the pandemic response if it's to have a better chance of connecting with all Australians.
Australia's outgoing Chief Medical Officer, Brendan Murphy, says international travel is unlikely to fully open up until a vaccine is found. On his last day as CMO, Professor Murphy sat down with the ABC's political editor, Andrew Probyn.
There were commenters saying we should go harder, some saying we shouldn't go hard at all and we should do herd immunity strategies. We took what we thought was a proportionate middle ground, and I think history has shown that that was largely correct.
Was there any advice that you suggested to the Prime Minister and others, the premiers, that wasn't accepted?
I don't believe National Cabinet or the Commonwealth Government has ever rejected any direction that the HPPC has provided. Yeah.
What took the most convincing?
I think probably the hardest thing for governments was the introduction of severe physical distancing measures because of the huge impact that had on the economy and the employment. And I've often said that 2 days after those measures were introduced, driving past the Centrelink office and seeing huge queues was gut-wrenching for me and for all the governments.
What will it take to open the international border, which is obviously one of the last steps that will be made?
Yeah, so I think it's to fully open the international border without any quarantining or any restrictions probably will require a vaccine to be able to adequately protect our vulnerable people in the community, and if we get enough vaccine to develop sufficient herd immunity. So I think until that happens, we are going to have some sort of border measures.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
A million new cases of COVID-19 are now being reported every week. The global tally is expected to reach 10 million within days. Nearly 500,000 people have died around the world. The US is still the worst affected country, followed by Brazil. And Brazil is responsible for half of the 100,000 deaths in Latin America. More than 25,000 people have now died in Mexico, which has more than 200,000 cases of infection. There are a few signs the outbreak is easing in a region known for its crowded cities and widespread poverty. Experts say the true scale of the damage is likely to be much greater than it seems because there are so few rigorous testing programs. Health officials in the US say the number of infected Americans is likely to be 10 times higher than reported. The estimates are based on antibody test results, which detect whether an individual has ever had the disease. The country's top infectious diseases experts say urgent action is needed to reduce the number of new outbreaks.
Right now, the next couple of weeks are going to be critical in our ability to address those surgings that we're seeing in Florida, in Texas, in Arizona, and in other states. They're not the only ones that are having a difficulty.
More than 50,000 people have been infected with coronavirus in Indonesia, and there's no sign the curve is flattening. The centre of the outbreak has shifted from Jakarta to eastern Java, where the death toll is now the highest in the country.
Dia Winnie Pertiwi has lost most of her family to COVID-19. Her parents, pregnant sister and unborn baby all died within a week. And now, as she grieves, the young woman is fighting the virus herself.
I was in a state of shock because it all happened so fast.
The family lives in Surabaya, Indonesia's second biggest city in East Java. It's now the epicentre of the country's infection. The death toll is even higher than the capital, Jakarta. Hospitals have been overwhelmed. A new field hospital is being opened to take the extra load. But medical staff too are at extreme risk. 175 health workers in East Java alone have caught the virus. Many have died.
Medical workers wore protective gear according to protocols, but the virus still got them.
Indonesia's official caseload has just reached 50,000, with 2,600 dead, just as Jakarta and other big cities start reopening for business. And with still one of the lowest testing rates in the world, the true number of infections in Indonesia remains unknown.
Meanwhile, the World Health Organization has warned that Europe is facing a resurgence of coronavirus, noting an increase in weekly cases for the first time in months. Many countries have relaxed restrictions and huge crowds have flocked to English beaches in defiance of social distancing guidelines. The WHO says if it's left unchecked, health systems in Europe will be pushed to the brink. Now, if you want to see more of that conversation with Dr. Hudson Valley and Sophie Scott, just check out the ABC News YouTube and Facebook channels. In the meantime, stay safe. We'll be back with more Q&A next week. For now, goodbye.